What are the side effects of having lip filler? Well, bleeding, bruising and swelling are probably the most common things, although we really try not to bruise anybody. It is very vascular. The whole face is very vascular, but the lips are particularly vascular. In fact, the vessels are only just about 3 or 4 millimeters from the surface of the lip filler, the main arteries, that is. Now, obviously, we try to avoid the arteries because you do not want a vascular occlusion. So we have to be extremely precise about where we're putting the needle when we're doing lip filler, because it is quite easy to go too deep. And the other thing about going too deep is that you often will get lumps on the underside of your lips. And these are the complaints that people come in having been seen by other practitioners who don't really have the right training, and they've got lumps on the underside of their lips. There shouldn't be lumps with lip filler. If there is, you need to go back to your practitioner and they need to deal with it. If you've got good injection technique and you've had a good check around afterwards, there shouldn't be any lumps there. Now, there is occasions where people do develop lumps as a reaction, delayed reaction, after having filler because they've reacted to the filler. Now, that is quite rare, but it is more common in people that have autoimmune diseases and things like diabetes. So this is why we'll always go through a thorough medical consultation before we do anything, so that you understand the risks for you as an individual. Any discomfort whilst having the procedure, we generally try to give you lots of numbing cream, so allow that to work. The fillers will have lidocaine in, and as long as you're not allergic to it, obviously, we can use that, and it generally numbs over time as we're doing more injections. Filler migration, again, shouldn't be an issue if your technique is good, provided that you haven't had lots and lots of filler before. Sadly, I think as we have more and more filler put in our lips, there is a risk of migration, irrespective of the technique that you've used. And I'm talking about over years, not over one session. It is all about technique. If you're trying to have massive lips and you're coming from a very thin-lipped position, yes, we may do it in stages, but if you're trying to have too much in there, it will only take a certain amount of filler and then it will migrate. So you need to go to a practitioner who's sensible and who understands your lips, who understands the proportions of your face and how it looks within your face and what is advisable for you and what isn't. And then you can avoid disappointment and, having to have things dissolved, etc. Generally speaking, lip filler gets amazing results in the right hands, and generally people have minimal downtime.